All right, your next guest says that we should go back to the free market. When we talk about health care reform, we need to let the free market work itself out. Let's talk about that, the Fed, and the economy. Joining us now is Peter Schiff, president of Euro-Pacific Capital, also co-author of Crash Proof, How to Profit from the Coming Economic Collapse, also perhaps has some political ambitions of his own. Peter, welcome. Stegan and Brian, thanks for joining us.
Thanks for having me.
All right, so this health care debate, right? It seems to me that there's two sides. There is the humanitarian side, which is that every American should have some kind of health coverage. That's a different debate. Let's talk about the economic side because they are different in many respects. What is the best way to accomplish maybe the first goal, but do that in the free market and not have the government plan or the government get involved?
Well, you know, the free market is the greatest economic system to supply affordable goods to consumers. And health care is no different than any other good. You know, it's the same for food, for clothing, for shelter. All sorts of products can be supplied by the market. We don't want them to be supplied by government because when government does it, when government gets involved, it interferes with that process, and the result is that costs spiral out of control and quality suffers.
Peter, would this mean your proposal, though, you would want the government to get out of Medicare and Medicaid and all other subsidies there, but would it also mean ripping up the employer-based insurance system that we have in place today to truly put everybody on a level playing field, individual by individual?
First of all, Medicare, the solution there is a bit more complicated. We never should have gotten into that situation in the first place. Had the government never adopted or passed Medicare in the 1960s, Americans would be in much better shape today. They would have more affordable health care. But the reality is it's a more complicated issue now because of the dependency.
Right.
But we definitely want to move immediately away from this employer-provided health insurance system, which is a function of our tax code, which is distorting decisions and leading to much, much higher prices. It would be much better if Americans bought their health insurance or paid for health care the same way they pay for every other good that they consume. We don't want to do it through the tax code where Americans get health care without any income taxes. So the best thing to do to level the playing field would be to tax the health care benefits as ordinary income, but simultaneously increase the personal exemption by an amount sufficient to make sure that Americans don't have a net tax increase. And then what happens is instead of getting health insurance from their employer, employees receive wages, money. And then they can do what they will with that money. They can use it to buy the health insurance that they want, and hopefully more people...
But the problem is that, Peter, is that they won't. You know, and a lot of families are struggling, so they have a couple hundred extra bucks. Instead of putting it in an HSA, health savings account, they'll say, well, you know, I got to pay my electric bill. I hear what you're saying. Is there a way to, and I had a viewer write in with this proposal yesterday, and I thought it was a pretty good one, force people to basically pay for their own
I don't think the government should be
healthcare first.
I don't think the government should be forcing people to do things. I think people should make their own choices with what they want to do. But I do think that if people had more money, if there was not as much taxes, people could afford to pay for their medical treatment because they'd have more funds. And if people bought catastrophic insurance, that's what people should be buying. You don't want to have insurance so every time you get a cold or every time you sprain your ankle. You want insurance for major problems.
The debate is interesting, right? Because I've made the point that maybe we are being misled on what the concept of insurance is in entirety. Right? We hear about insurance reform. Insurance is something you purchase to hedge against a risk. You know, and I buy fire insurance because I don't want my house to burn down. If it does, there's a small risk. It will be covered. I don't buy the insurance once my house has already caught on fire.
Well, of course, then it's not insurance, then it's a gift. But, you know, my father was in the insurance business. And in the 1960s, his most popular policy that he sold was a major medical policy. And it cost $15 a year. A year. That's all an American had to pay to buy health insurance was $15. Now, it had a $500 deductible, which back in the 60s was a lot of money. But if something really bad happened, you were covered. But if you needed money to pay for routine medical care, you saved your money, and you paid for it out of savings, which is exactly how it should be.
But, Peter, you are competing for the Republican nomination for the Senate in my home state of Connecticut as well as yours, clearly. And you're proposing ripping up the system that insures the vast majority of Americans. That might not get you elected, Peter.
Well, if I do choose to run, hopefully you'll support me. But what I want to do is I want to restore, and I don't have a proposal yet, but what I want to do is restore free market forces, bring them back to bear on health care so that we can control costs. The problem with our health care is not the quality. We have good quality because the free market is providing the quality, but the government has circumvented all the market forces that would control the costs. If you look at, take an example of cosmetic surgery. Where you don't have insurance, where people are actually paying for their health care on their own, where you have competition among doctors, and where people are price sensitive. Over the last 6 or 7 years, the cost of breast implants, adjusted for inflation, has actually gone down. And of course, LASIK surgery, eye LASIK surgery, has gone down quite a bit. It's because of all the insurance. When people go to the doctor today, nobody cares what the procedures cost because nobody is paying for it. And the doctors know this, the hospitals know this. There's no control on cost. People pay whatever it is. But if we had more Americans paying for their health care out of pocket, then they would care. Right. They would shop around. And the doctors would care. There would be competition to bring prices down.
All right, Peter, we do appreciate you coming on. We got to leave it there, but we'll get you back on soon. Listen, you're making some arguments that a lot of people would agree with, but I guarantee a lot won't. But that's what the debate is all about. Peter Schiff of Euro Pacific Capital. Peter, thank you.
Sure.